Good morning, everyone, and welcome to our webinar on the introduction of a private hospital services table of costs. We appreciate that everyone is busy as we head towards the end of the financial year, so thank you for making yourself available for this session. My name is Matt Bannon and I'll be your presenter today. I'm the Executive Lead for Provider Engagement and Performance at WorkCover Queensland. I'm also the lead for the Optimising Treating Services and Outcomes strategic program of work, for which the private hospital table of costs is a key initiative. This is our second webinar as part of the consultation process for the new private hospital table of costs, and is the start of the second open for comment process, which I'll explain more about later in the session. WorkCover Queensland acknowledges and pays respect to Queensland's elders, past, present and emerging. We thank the traditional custodians of country throughout Australia for their ongoing custodianship of land, waters and community. Today's webinar will run for approximately 1 hour, including time for questions. The session will be recorded and will be available on our website in the next day or so. On the screen are some tips for interacting with us today. We encourage questions and I'll do our best to answer them in today's session. If you don't get to the questions today, we will do our best to come back to you after the session. We're also aware all queries, we'll also ensure that all queries are added to our FAQs, which are already on our website, and I'll show you that a little later. Now I'll show you where, and also show you later where to find these on the website. This is our agenda for today. For those who attended the last session in February, we will revisit some of our previously presented information as background. Today we'll briefly discuss background to the new private hospital services table of costs. We'll wrap up our first open for comment process, discuss our approach to fees with the new private hospital services table of costs, discuss our approach to specialised services within the new private hospital table of costs, and the next steps, including the second open for comment process, how you contribute in the process. Queensland insurers currently face 6 key challenges in private hospital arrangements. Number 1 is inconsistency. An inconsistent service and fee structures exist across the various arrangements with private hospitals. 2, responsiveness. The variety and complexity of current arrangement hinders our flexibility to respond in a timely manner to emergent events. Costs. Private hospital services represent a significant proportion of the annual medical expenses to Queensland insurers. There's a lack of visibility. It makes it difficult to analyse, check and understand compliance to service delivery standards. Maintenance, there's high ongoing business as usual costs to maintain current arrangements. And number 6, recovery and outcomes. Insurers have seen collective delays and extensions in recovery durations and on claims increasing in duration overall. We need to design a system that allows us to better deliver timely and quality outcomes at the right price. As part of our environmental scan working through the process, we've looked across jurisdictions. We've looked at Victoria, New South Wales, South Australia and the Northern Territory Heads of Workers' Compensation Authorities. All utilise fee schedules and rate orders as we currently know. A calibration activity was completed with some international authorities and this confirms similar arrangements. Please note WA dictates fees for public admissions only. ACC New Zealand outlines fees payable for treatment and hospitalisation. Thank you again for your time and feedback since we commenced this process. It's been clear in our discussions today that simple structure was the favoured option for private hospital services table of costs. We've undertaken a significant consultation since we started this process, which is set out on the current slide. You'll remember that in January, February 21, all current contract holders were notified of this initiative and the upcoming open for comment process. Private Hospital Association of Queensland and the Association of Self-Insured Employers in Queensland were also notified. And in February, March 21, we took out our first open for comment process and a number of you submitted your feedback, so thank you again. And today commences this second open for comment phase and this webinar is the starting point for that. Again, I want to reiterate, thank you so much for your feedback and input into this process. This feedback has helped further inform the design and the format of the new table of costs. Some of the feedback and resulting changes included adding specialised services into the table of costs. We've also changed some of our terminology to align with more common uses, for example, changing the reference from outpatient to day patient. We've expanded our explanatory notes. We've also redefined or refined our definitions and expanded our quality assurance expectations within the table of costs. We want to help you and we're committed to making this transition to a table of costs as easy as possible. Through the second open for comment process, we ask you to provide us feedback about your system requirements, including lead time to make this happen. We're here to help and provide assistance with administering system requirements. We can send someone to your site and we can have an online meeting to set up this fee arrangements and how it works for you. And we'll make contact with you following this to work out how this looks and feels for you as we move towards launch date. Now, let's talk about the private hospital service table of costs. We've previously shared the structure of the new table of costs. Again, thank you for your feedback in helping us to shape its format and design. We've now included maximum fee schedules within the table of costs, including specialised services, which we'll explore shortly. The new table of costs will be formally gazetted, including the maximum fee schedules, prior to it going live date, which is the 1st of December 2021, but with an expected publication date on the 1st of November 2021, to allow all parties to be ready for commencement. So let's talk about the fees. So which items in the table of costs have fees? Same day accommodation, overnight accommodation, theatre, prostheses and provision of health records. And there are some that don't have fees at this stage. So these are our specialised services, including mental health programs, rehabilitation programs, pain management programs, alcohol and other drug programs. These programs are subject to the provision of a request for a specialised services form and insurer pre-approval, and we'll discuss this process shortly. Now, how have we undertaken our fee modelling? So undertaking this, we've referenced a number of sources to develop those fee structures. We've assessed our own data, contracts and other available information for private hospital fees and the utilisation of these services. We've consulted with other workers' compensation jurisdictions and personal injury schemes, and we've also looked across not just Australia, but also internationally. We've also made contact with private health insurers to gather their understanding of how this works at their end, and we've also had a look at our public hospitals, including insights from our current public hospital services table of costs. What we identified through the new fee modelling services is that based on publicly available information, WorkCover Queensland is the highest paying workers' compensation scheme in the country. There is significant fee diversity across jurisdictions and private insurers, and the proposed table of costs is aligned to other jurisdictions and private insurance, and is more simplified than the existing public hospital services table of costs. So the next slide, what I'm going to do is show you through some examples of these maximum fee schedules. Now, please note, these are just examples of some typical fees in the new table of costs. What I've got set up here is some theatre fee examples and some overnight accommodation fee rates. Please note that the numbers listed in here are maximum fee schedules. So following this webinar, we will send all attendees and those who registered for the event a copy of the new table of costs, including the fee schedule. This will allow you time to review and consider the table of costs in totality, and as part of the open comment process to allow you to provide feedback. What we have done is had a look at multiple theatre fees. As part of the table of costs, we now made some changes in relation to that when it's involved in a single theatre session. So we'll move to the 150-25 rule to align with MBS. So 100% for the service with the highest theatre charge, plus 50% for the service for the next highest theatre charge, plus 25% for each of the other services provided. Now that's different from what we previously had. So most contract holders currently are billing at a different rate, so at the 133.20. So what you will see that is an increase in terms of fees for multiple service items across that, which is a change. Now it was set out in the first table of costs. We thought it was just something interesting we point out that actually will increase some benefits towards you in terms of payments. Now, based on your feedback, one of the things that did change was the addition of specialised services in the table of costs. The following specialised services are included in the table of costs. However, they will not have specified fee allocation at this point in time. Mental health programs, rehabilitation programs, pain management programs, alcohol and other drug programs. From our experience, the offerings for these services can be complex and differ significantly between hospitals. For the initial period of 12 months, these new item numbers will not be allocated a specified fee. Our aim is to gather and analyse detailed data for these services. This will help us make more informed decisions on price setting for 1 December 2022. To assist us with the initial 12-month period, we'll be introducing a simple but standardised request and approval process. We've developed a new form to capture any requests for these services. On claims where these services are required, you will be required to complete the form, attach a copy of the requested program framework, and return it to the insurer responsible for the claim. If the insurer approves the requested program, you will be notified. This new process is designed to streamline the administration of these services for all parties. And what we've got here is an example of the new request form. This form will be included with the table of costs and will also be added to the WorkSafe website ready for 1 December 2021. As I indicated earlier, we want and value your feedback. We will have a dedicated page on our website and we'll be able to access information on the private hospital table of costs process. Frequently asked questions. These will be updated as questions are received to ensure everyone has access to these response to the information and clarity. An area for you to submit your feedback. You'll be able to provide your feedback submissions either by completing the online form or uploading a file. And please let us know in this open for comment process any of your system requirements through this so we can adjust and work with you moving forward. Your feedback will be collected and used to inform future decisions associated with this initiative. However, it is important to note that your feedback will not be published publicly. All information collated during this initiative will be handled in accordance with the Information Privacy Act and our responsibilities to you. Please note, anyone who registered and or attended this webinar will be emailed a copy of the table of costs included in the fee schedule. What I'll do is I'll just take you through and show you what it looks like on my website. A second. So when you're looking for this, there's a number of ways you can do it. You come to our homepage, you scroll down to the bottom, right to the bottom of the page, click on Working with WorkCover, scroll down, and you'll see the Open for Comment Private Hospital Services Table of Costs tab, and you can click onto that, and you can access all the information. So we've got information on the background to the program itself, what's happened, what's changing, option to use the priority feedback. It's also the first step, phase 1, phase 2. And also across to the right, you will see we have a full list of FAQs from the first open for comment process, quite extensive. And what we'll do is we'll attempt to amend, adjust, add to this as we go along, and that'll be based on the feedback you provide to us through the open for comment process. So this is the timeline for this initiative. As you can see today, we'll go live with the second for open comment process, focusing on fees. It's open until the 4th of August 2021, and the ultimate aim of publication date of 1st of November 2021, and an effective date of 1st of December 2021 for the new table of costs. The open for comment process will be open for 6 weeks, as alluded to. We'll welcome your feedback once you've received the table of costs. We're keen to hear from you how the fee schedule, specialised services, your system requirements, and how we can help you to best prepare for these changes. We'll collate all feedback and respond accordingly during and after the open for comment process, as well as updating the FAQs on our website. As I said, on the side you can see you can come through the official process for the open for comment, or you can actually contact us via the communications email address as listed on the right. Okay. So again, thank you very much for joining us today. We now have some time for questions. As I said before, please note there's extensive FAQs already on the website that I would encourage you to review as well. These FAQs were based on the first open for comment process and ongoing discussion with your providers. And again, we will update these as we go along. We've got a couple of questions here. We've got a question here understanding how is the methodology applied to the pricing? The methodology incorporates analysis of scheme data, broader jurisdictional comparisons, and consultation with stakeholders. And we've got another question here. Have performances or service levels been factored into the pricing? Well, no, not at this stage, but we will be looking at performance measures moving forward to assist that. And that's actually capturing some of the data that's involved from the table of costs, better understanding of the services are provided and outcomes related to that. Let's see if we had any other questions come through. Well, I've got a question here about, can we negotiate a different fee if we believe the listed fee is not commercially viable for our hospitals to deliver? No, there's no option to negotiate a different fee. Once the private hospital services table of costs is gazetted, that is the formal rate applicable to the service. WorkCover cannot or will not pay above the gazetted rate moving forward. And there's a question here just also about what do I need to do for invoicing in relation to general. Well, we're not changing the way we're doing invoicing, but what we will do is work with you closely on a better way to do it that's more efficient, and we can do that through B2B. So what we'll do is current invoicing will not change. However, we're really keen to move to this new approach, which will streamline the process, simplify it, improve timeliness of payments, and also reduce some of the administrative demand. So what we'll do is we'll reach out to you individually after this to work out how we can best do and support you through this process to be ready for 1 December 2021. That seems to be all the questions. Thank you very much for your time today. We really appreciate your valuable input into this process, and we look forward to your participation in the open for comment process. If you have any other specific questions, my contact details are also on the screen. Thank you, stay safe, have a great rest of your day.